The Ebola virus is a deadly disease that is a cause for concern worldwide due to a lack of containment and treatment. The disease originated in Africa and remains largely centered in this area, although it has been reported in other countries, including the United States. The virus is transmitted by contact with body fluids of an infected patient. Currently, this epidemic is deadly and growing. Research into vaccinations and treatment is being conducted in countries worldwide and is the main focus of the World Health Organization. In this presentation, the following topics will be covered. What is Ebola virus? How is the virus transmitted? What treatments are available? And what expectations are there for the future? Ebola virus is a relatively new disease in our population. It has been tracked for almost 30 years now. The newness of this virus leaves many unknowns. Formerly known as Ebola hemorrhagic fever, it is a severe and often fatal illness in humans. Today, the origin of this disease is not evident, but progress is being made in treatment and prevention. Recent outbreaks are at the highest they've ever been, and due to this increase, research into the virus has intensified.
Ebola is a rare and deadly disease caused by infection with one of the Ebola virus strains and can cause disease in humans and non-human primates. Ebola is caused by infection with the virus of the family Filoviridae, genus Ebola virus. There are 5 identified Ebola virus species, 4 of which are known to cause disease in humans. Ebola virus, Sudan virus, Typhorus virus, and Bundibugyo virus. The 5th virus has caused disease in non-human primates, but not in humans. This is the Reston virus. All 5 viruses have caused outbreaks since the first outbreak in 1976, as shown in Table 1. Ebola viruses have been found in several African countries near the Ebola River, where it got its name from, but the natural reservoir host of Ebola virus remains unknown. New studies suggest an insect-eating bat may be the origin of the Ebola outbreak of 2014. Since the first Ebola case in 1976, scientists have pondered the mystery of where the fearful bug hides. Investigation began in the village of Melando in Guinea, where the first Ebola outbreak began. During 8 days of being in the small village, a team gathered testimonies from survivors and samples of blood and tissues from captured bats. From this data, a new hypothesis emerged. Maybe the reservoir host was not a fruit bat as suspected, but a different species of bat. While fruit bats are abundant in southeastern Guinea, they don't roost in large aggregations near Melando. The village did, however, harbor a sizable number of small insectivorous bats, which roosted under the roofs of houses and in natural resources such as hollow trees. Laboratory results from those samples may suggest whether Mops condylarus is a hot lead in the search of Ebola's hiding place or just another dead end.
Ebola is transmitted by many body fluids, which include vomit, saliva, mucus, feces, tears, sweat, breast milk, urine, and semen. It has been discovered that the transmission of Ebola is only possible once the person infected is symptomatic. Possible indications of being symptomatic are fever, diarrhea, and vomiting. Contact with infected patients increases risk of infection if exposure to the patient's body fluids without protective equipment occurs. One way that Ebola transmission is trying to be contained is by screening at airports around the world. This screening process started in August 2014 after a recommendation from the World Health Organization. The most affected countries are the center of the screening process, especially if travelers are returning from Guinea, Liberia, or Sierra Leone. A screening at an airport includes taking the traveler's body temperature and various questions regarding the presence of fever, diarrhea, and vomiting. Generally, there are three specific phases of illness. The first stage begins after the appearance of a nonspecific fever, headache, and myalgia. This first stage is followed by a gastrointestinal phase that includes symptoms such as diarrhea, vomiting, and dehydration. During the second week, the patient will either show signs of recovery or start deteriorating. The third phase is life-threatening, and problems that may occur are body collapse, neurological manifestations, and bleeding.
The treatment of Ebola is a very difficult task, mainly because the virus itself is relatively new. Scientists, however, have discovered some effective treatments. One is naturally produced in the human body. This treatment is the naturally occurring antibodies that are produced during the immune response. However, since antibodies are the only available course of treatment, the alternative is to let the disease run its course.
The best treatment for the Ebola virus is the naturally occurring antibodies in the human body. The two main antibodies are called KZ51 and ELZ510. They are the best means of fighting off the Ebola virus, with KZ51 being more efficient of the two. However, the best treatment is plenty of rest and plenty of fluids. Although KZ51 is the only one of the two antibodies to completely neutralize the Ebola virus, only in some cases, they both work to slow it down and weaken it. ELZ510 slows down the virus enough for the rest of the immune system to take effect. This includes KZ51 coming in and neutralizing the Ebola virus. This makes KZ51 the most effective antibody when it comes to fighting off the Ebola virus.
The Ebola virus has been recognized as a deadly disease since its first recorded outbreak in Zaire in 1976. There were 318 cases recorded with an 88% mortality rate. Since that time, there have been numerous outbreaks over the years, but none as large as the most recent outbreak in 2014. As of March 24, 2015, there were 25,263 cases reported and 10,477 deaths. The number of patients is consistently growing as the investigation into this outbreak continues. With the most recent outbreak being so large, significant resources have been allotted to the search for a vaccine for this disease. The Canadian government donated 800 vials of the Zaire Ebola virus to the World Health Organization for use in developing a vaccine. In developing the vaccine, 138 patients were used in the trial. The trials were conducted in Hamburg, Geneva, Lambaréné, and Kilifi. Although there were multiple side effects reported ranging from arthritis to skin lesions, there were no serious adverse events associated with the vaccine. The drug company Merck is now overseeing further research of the vaccine that has been developed. Future research is required to find a balance for the viral dissemination of skin and joints that occurs with the vaccine and potential control of outbreaks of the Ebola virus. The virus was reported in Dallas, Texas, where a man had become infected after returning from Liberia in September 2014. This was the first laboratory-confirmed case of Ebola to be diagnosed in the United States. The individuals the patient had come in contact with were contacted and placed under a 21-day monitoring period. This became protocol for subsequent cases that appeared in the United States. This type of tracing aided in containment of the virus. As the virus appeared in the United States for the first time as an infected patient, the president declared war on the virus. Military efforts have been directed to West Africa to aid in containing the epidemic and prevent the disease from traveling to other continents. The effort will include providing beds for Ebola patients, assisting civilian organizations working in the area, trained workers, and an overall education to treating patients with this disease without othering its spread. As we learn more about this virus in the future, we'll be more equipped to control this epidemic. The virus is easily spread through contact with body fluids, so containment and proper care for patients is of the utmost importance, and aid in the areas where this virus originates will help to contain the spread. Hopefully, with further research by companies such as Merck, a vaccine and treatment will be available in the near future.